need to come to you this morning on Friday to share the latest decision we've made for our church. The current number of confirmed COVID-19 cases in our community have reached a serious level. The staff and I have been in consultation with hospital leadership and medical personnel in our community and our congregation. We've reached a point where we must take the following steps as of this Sunday, June 28th. There will be no 8:15 service. Sunday school will maintain social distancing, and that will be accomplished by classes being reassigned to different rooms to make social distancing possible. The 10:50 worship service will observe strict social distancing. That's accomplished by every other pew not being available, and then the ushers helping people get situated in order to maintain social distancing. There's a couple of real issues in our community that help drive this decision, besides the fact that we have seriously increased numbers. One is the test kit situation. The test kits available to our community are limited, and the labs where testing is actually done in the Houston region have reached capacity to where now tests are performed physically in another state. That makes testing and test results a very serious challenge. The other factor is the capacity of our hospital. It's reached a point of concern. I'm not in a position to announce absolute numbers. That's just not my place to do so. But in talking to our hospital leaders, I know enough to where I would say we need to be part of the solution and not part of the problem, because our hospital needs to be able to serve the needs of our community. Now, in connection with these steps we're taking at our church, there are considerations to be made when making your decision as to whether to participate physically at our church facilities. First, if you're 75 or older, you're advised to stay at home as much as possible. If you're 60 or over and you have these underlying health conditions, you're advised to stay at home as much as possible. Those conditions have been communicated throughout the pandemic, and the most obvious are these: heart condition, cancer treatment, presently or recently, type 2 diabetes, chronic kidney disease, COPD, and a compromised immune system. Of course, you should consult your physician if you have questions regarding your personal risk level. The list I've shared is just the one that's generally published. These measures are to be in place for the next 3 Sundays: June 28th, July 5th, July 12th. We hope that during this time, the situation is going to improve on a local level, and then we can return to our normal schedule with social distancing, of course, being maintained. On the other hand, if the situation grows worse, we'll have to communicate whatever steps we believe we need to take. So let me go back and tell you the 3 decisions we're making for now, starting this Sunday. No 8:15 service. Sunday school will maintain social distancing. And then 10:50 will observe strict social distancing. These decisions are hard to make because of so many factors, including limiting the opportunity people have to worship and be with others spiritually. And I appreciate your support as we make these decisions. And I encourage us to pray that we would see God's hand locally with our numbers, and it would open up soon to come back together. God bless you.